So first of all, in order to understand the disease process, it's always a good idea to have a look at the background and the incidence of the disease process. So we're going to take a look at the backgrounds of strokes. Strokes actually happen more than you might think, and as you'll see from this video, the incidence and the prevalence of stroke is actually increasing as the population grows and ages. So let's take a look at the background of strokes. There's actually over 100,000 strokes in the UK every year, and this is actually equates to around 1 stroke every 5 minutes. Around 1 in 6 men will have a stroke in their life, and around 1 in 5 women will have a stroke in their life. And from this data we can see that the prevalence is actually greater in women, and the reason for that is that they actually live longer than men statistically speaking, so women are more likely to have a stroke. You have an increased risk of stroke within 30 days of having a previous stroke as well, so that's why we try to treat people with antiplatelet therapy. And generally, if you've had a stroke, 1 in 4 will actually have another stroke in the next 5 years. So the risk factor for that is about 25% of patients will have a stroke in the next 5 years if they've already had a stroke. If we take a look at the incidence, we can see that it's actually increasing. So by 2025, we're looking at about 150,000, so around 50,000 more. But then by 2035, we're upwards to 200,000. So it's a safe bet to say that within your career as a paramedic, you're going to see more and more patients who have a stroke. And the reason for this is that the prevalence is increasing. One of the biggest risk factors for stroke is actually age. And what we can see from this graph here along the bottom is that as the age of the person increases, the more likely they are to have a stroke. And if we take a look at the left, it's the number of patients admitted with a stroke to hospital. The purple lines are male and the blue lines are females. And what we can actually see that as we go up the age range, more males below the age of 80 have strokes. But what we see is above the age of 80 to 84 and on to 90 plus, females actually take over. And the reason for this is that females statistically are more likely to live longer. So your elderly patients over the age of 85 are more likely to be females who are having a stroke. But what we can say from this data is the prevalence of stroke increases dramatically with age.